All right, so now we're going into our next portion and we're going to zoom into Boone Health, where physical and occupational therapies is really center stage. Now, we talked about it earlier. If you were Patrick Mahomes going into the Super Bowl and you had a sprained ankle, you would need a physical therapy plan to get you back on track and in the game. So, if you believe that there is no pain, no gain, physical therapists actually help improve the patient's ability to get past the pain so they can go on gaining. With that, we're going to go inside Boone Health right now and see what it is to be a therapist.
One of the great things about therapy is you can start out in one area and you can choose to switch it up and do something different over your career without having to necessarily go back to school. So there's home health, there's outpatient, there's inpatient, and even within the inpatient world, there's pediatrics, there's geriatrics, there's all kinds of different opportunities.
I work in rehab department for physical therapy. I have been working for Boone for the last 8 years now. I love my job because of many reasons. We are the ones who help people get back to their home. We help people in community reintegration. Typically, I work on rehab floor. That's my typical role. The things that we do involves like walking, getting them do exercises, and in a good day, we also take them outside, try and walk with them outside, depending on their potential and what the expectation is. When I was in high school, when I was trying to see the different career paths that I would take, I feel like I knew that helping people is something that I would always want to do, but I love the fact that physical therapy helps in getting the patient back home, with their loved ones, in their normal surroundings, in their normal jobs, if applicable.
I am a speech-language pathologist here, and I work in the outpatient setting, and I also work in the inpatient setting. So I bounce around just a bit, but I'm primarily over in the outpatient setting working with pediatrics and adults. I love working with people. I'm very extroverted, I'm very talkative, and so whenever I was thinking about a career, my mom was a teacher, and she was like, you should be a speech pathologist. And the more and more I looked into it and I saw how diverse it was and how many different things you can do as a speech pathologist, I was so excited. The best part about being a speech therapist is it is the most rewarding career I could ever ask for. I get to watch kids learn to talk. I get to watch parents hear their children talk for the first time. I get to help people after a stroke get to eat their favorite meal again or drink their coffee. There's nothing about it that is not rewarding.
Well, I'm David White, and I'm an occupational therapist at Boone Hospital. I work on inpatient rehab for the most part, and then I kind of work around the hospital seeing acute care patients also. What I like to do here at the hospital is help people get back to doing the things that they really want to do after they've had an injury like a stroke or a physical injury, and it's my job to get them lined up with equipment that they might need to return to home and to learn how to do things maybe in a different way than they were doing it before. How does a person know if they want to be an occupational therapist, or what should they do if they want to pursue that? I would say hands down the best experience is to job shadow. You just have to spend time with therapists and see what they do, and in different environments, because it can be dramatically different depending upon the situation that they work in.
So my job is really dealing with rehabbing any conditions that have to do with the muscles of the pelvic floor. So that tends to be issues of urinary, bowel and bladder control, sexual health, any issues that come up during pregnancy or postpartum rehab. So I do a lot with like the core and just kind of getting people back to doing what they want to do. So average day I spend an hour with each patient one-on-one. We do like a full assessment of everything that's going on with their issues. And then we do all sorts of different exercises, breath retraining, core retraining, and I just kind of see my patients and then have lunch or maybe a few meetings with my coworkers. My team, the pelvic therapists within our specialty, will kind of meet together and discuss new research and learning new topics, and so there's a good variety. Physical therapy is kind of cool because when you go through PT school, you don't have to choose a specialty, you learn all of it. So you can really go into any field. I started in pediatrics and then switched into orthopedics. I've done some of that stuff inpatient, some outpatient. And so if you realize you're in a field you don't like, you can switch.
I think people pick this job and they come back to this job because those moments when you make a difference, I mean, there's nothing better than that. I think it's rare that people feel like at their job that they are changing someone's life for the better. It provides a sense of fulfillment in your workplace. We spend a lot of time at work in our lives, most of us do, and it has to be meaningful, I think, for people.
You know, occupational and physical therapists keep us moving and grooving. And now we're going to go live into Boone Health, where Tracy Evers, Director of Therapy Services, is zooming in. Tracy, welcome to Missouri Healthcare Career Day.
Thank you.
Well, if you'd like to just kind of explain a little bit how you got into this pathway and what you find most gratifying, and then we'll go to our Q&A. We have some students already submitting questions.
Great. Yes. So as you all saw in the video, my name is Tracy Evers. I am the Director of Therapy Services and the Rehab Unit and Pain Management at Boone Health. I got started in the career of therapy, interestingly enough. I wanted to be the first female trainer for the Kansas City Chiefs. So it was interesting you brought up Patrick Mahomes in that story. But I ended up changing my pathway after my grandmother had a stroke at a fairly young age. And when I was in high school and trying to decide what careers to do, I kind of got interested in therapy. I graduated from the University of Missouri with degrees in biology and physical therapy in 1993, and then I came to work at Boone Hospital Center. Boone Hospital Center has grown over the years. We're now Boone Health. We consist of the hospital center here in Columbia, and then we also have medical clinics throughout 26 counties and a home care and hospice. As far as what my career looked like, I started out in the hospital working primarily with inpatients. And then as I grew in my profession and my career, I sort of took a path towards supervision and management. Boone Health really cultivated that in me. I had some great mentors, great leaders and bosses within Boone. And in addition, they helped fund my MBA, which I got in 2008 through Columbia College. So I kind of feel like my career started out in primarily inpatient care with adults. I was able to help start the inpatient rehab unit, which I manage now, which deals with PTOT and speech for patients that have suffered from injuries like a stroke. And so through that process, I feel like my career has developed to where now I primarily manage, but it's the same type of feeling that you get when you're providing care with patients that I like to say I feel like now when I'm providing care to my staff. And so that's just a little bit about me and my career path. I did find out recently through a study that physical therapists are reported to have one of the happiest careers, and they feel very satisfied in their job because most all therapists feel like their job gives them meaning. And so I feel like I definitely see that in my staff and felt that way in my career. So I just feel really good about therapy as a career path for young people today.
You know, Tracy, you hit on a great point. In fact, I had gone through a physical therapy for a couple different injuries and was a longtime biker and skateboarder and ran into a lot of different issues with that. But every time I'd go into a PT to see them, they were always very passionate, very inspiring, and always were positive. So you really do kind of uplift the mood of your clients and patients each day. So we have a couple questions coming in. In fact, one's right there next to you at the Columbia Area Career Center. Students want to know, how would a high school student start their career as an OT?
Great, as an OT, yes. So I would say if you're in that career pathway class, that's a great way to start. But what I always tell people to do until you're 18, where you can really maybe get some of that experience and work, is to talk to therapists. Talk to occupational therapists that work in a variety of settings. I think David even mentioned this on the video. You want to get a sense of occupational therapy as a whole. You can always visit our website at boone.health go to services and look at therapy services, and that can give you some insight. But really talking to people about what they do every day as an occupational therapist in different settings, whether that be the hospital, outpatient clinic like where I'm at today, or in the home with home care.
Great answer there, Tracy. We have another question, kind of similar to that. Truman High School, what is the hardest type, either physical or occupational therapy? And then what is the longest? I guess that depends on the injury.
Yeah, I don't know that I could say there's a hardest type. I think that therapy can be long, especially for those patients that have a very severe injury. I would say probably the longest experience that's sustained in therapy would be those that have a serious, probably spinal cord injury. That's probably the one that I see still has a long length of stay. You're going to start out in a hospital. If it was traumatic, maybe even in an ICU, and you're going to have PT and OT right away, and they're going to be with you through that entire stay. You're probably going to go on to an outpatient setting after a stay in an inpatient rehab. There are some pretty large ones throughout the country, and then there are ones that are hospital-based, like ours here at Boone. And then you may be familiar with other ones in town as well, but usually requires a stay like that. And then there's going to be ongoing outpatient and even some home health in there. So that's probably the toughest that I would say, and probably the longest course of treatment that you would have would be that type of diagnosis.
So one other question from CACC. Mandy asks, how do OTs and OTAs work together? Oh, diving into the weeds there.
Yeah, that's a great question. OTs and OTAs work together very well and collaboratively here at Boone, and I'm sure it's true in other organizations. So occupational therapists will go in and typically evaluate the patient, and they will create a plan of care for that patient specific to their injury or whatever diagnosis they may be treating. And then they'll collaborate, and that OTA will come in and follow through on that plan, working directly with the patient. And then usually they'll get back together, depending on the setting. It may be the same day. If it's an inpatient setting, it may be within the same week if it's an outpatient setting. And they'll talk about how the treatment went, how the progress went, and then they'll collaborate and maybe advance that program together. At some point, the occupational therapist will have to go back in and reevaluate and reassess and advance, and then work again with the OTA to carry through the next treatment session. So that's kind of an idea of how those two work together.
We got another student that's coming in, Cheyenne. If we have Cheyenne that can go live. She is from New Caps in Neosho High School. And it's far away down in Neosho, so it's going to take a little while for the broadband to connect.
Also video. Okay.
Go ahead.
Your question?
There we go. Excellent. Hey, you're live. We
Hi.
see you. We can hear you. Go ahead and ask
yeah,
Tracy your question.
How much has changed in your field since you started?
Good question.
Oh gosh, that is a great question. I was thinking about that a little bit when I talked about how I had started out in 1993 at Boone. I was working a lot with orthopedic patients, so this is just one example, but when people would have their knee replaced in 1993, they would stay in the hospital somewhere on average of about 5 to 7 days, and now they stay an average of 1.5 days. So that's just one example of the advances that you see when it comes to surgery and post-surgical care. I would say that's probably the thing that I see that's the most different. Another thing that's a lot different, since when I graduated, as I mentioned, physical therapists received a bachelor's degree, and now physical therapy programs are a clinical doctorate degree. So that's definitely much more advanced education and training that you get now as a PT. You're seeing that same trend in occupational therapy. Speech pathology has always been a master's program, and then they do what's called a CFY, or a clinical fellowship year, where they're under the supervision of a speech pathologist. So the education level and the amount of information that therapists have today is vastly different than when I graduated from school. I would say that's probably the biggest difference, that and just keeping up with the advancements in medical care and understanding the advancements in treatment philosophies that have changed in therapy. Also, many states throughout the United States have direct access for physical therapy and occupational therapy and speech. And what that means is that people in the community can seek services from a therapist without a physician referral or an order. So those are some big changes that I've seen.
Wow, that's quite a bit. And I would imagine all kinds of new tools and technologies that are integrated into it. I know with geriatric health, they're deploying different types of video games, virtual, so that they can get their muscles moving and keep them active. So technology is definitely being a part of it. One of the follow-up questions, Tracy, and this is what the young man from Independence, what are the cons of being a physical therapist? So are there any downsides to being a physical therapist?
Well, I would say, some of the cons, depending on where you work, could be the schedule. In the inpatient hospital settings, especially, there are no days you're closed. So you are usually working some weekends and some holidays. So there's definitely, for some folks, a challenge when it comes to that type of a schedule. Another con is just the same cons that I think you see in all of healthcare professions, which is it's a hard job. It can be mentally and physically taxing. And, with healthcare, there's a lot of change. It's usually rapid. And so for folks that don't do well with, adapting to change and don't want to necessarily feel sort of that anxiousness that you might feel in a healthcare environment. The pandemic was a really good example of that in the career of healthcare, whether that's therapy or nursing. There were a lot of changes that came at us for several years, and just having to adapt and deal with those is something that I feel like is unique in the healthcare environment.
I would say so. Change is constant in the healthcare environment. So we have a fun question. Camden Middle School wants to know, have you ever treated a celebrity?
I have not treated a celebrity. I have treated some athletes when I was a student that, played sports at different colleges. But I have not treated any celebrities at this time. I still have a lot of time in my career. So who knows? One of those students may become a celebrity. And if you do, I want to treat you.
Great. All right. Well, Tracy, thank you so much for joining us for Healthcare Career Day. And, thank you for all that you and your team does at Boone Health to keep people moving.
We appreciate that so much. Thank you for your time, and thank you to all the sponsors that made this day possible for these students.